Drug abuse isn't just about street drugs. Besides marijuana, opioids and other illegal drugs, legal medicines are the most commonly abused drugs in the United States. Over-the-counter and prescription drugs can help and heal us, but some can be addictive and dangerous if they're used the wrong way. In this video we discuss some of the most abused prescription and over-the-counter drugs. 1. Barbiturates. Barbiturates are central nervous depressants. They reduce the activity of nerves, causing muscle relaxation. They can reduce heart rate, breathing, and blood pressure. All barbiturates affect gamma-aminobutyric acid (GABA), a neurotransmitter chemical that nerves use to communicate with each other. Barbiturates are medications used for treating headaches, insomnia, and seizures, but if you take more than prescribed, you can get addicted. High doses can cause trouble breathing, especially if you use them with alcohol. If you can't function without barbiturates, get help. Going into withdrawal can be dangerous. 2. Benzodiazepines. Benzodiazepines may be used to treat alcohol withdrawal, anxiety, as a muscle relaxant, panic disorder, seizures and sleep problems. These drugs are effective but when overused can lead to dependency and addiction. If you cannot go to sleep without taking this drug even after your prescribed dose, please talk to your doctor and do not use it after your completed dosage. Stopping the use of this medicine abruptly can also be dangerous. 3. Sleeping pills. Many people wrongly assume they can't get addicted to sleeping pills, and some people even claim getting this information from their doctor. Yet, some people find themselves unable to sleep without the help of a sleeping pill. As tolerance increases, many find that they need to take larger dosages to obtain the desired effect. A lot of people don't realize they've become dependent, or possibly addicted, until they stop taking their sleeping medication and all of a sudden they begin experiencing withdrawal symptoms. Some of the signs that you are addicted to sleeping pills include having several failed attempts to quit, getting cravings for sleeping medications, seeing more than one doctor for prescription refills, continued usage despite negative consequences and experiencing frequent memory loss from the pills. 4. Codeine and morphine. Though it's included in cough syrup partially for cough suppression, there's not technically enough evidence that it possesses this attribute. It's actually better for treating diarrhea, especially in association with irritable bowel syndrome. This substance is broken down by the liver and reverts into morphine. It's a naturally occurring substance that makes up about 2% of opium, and is the most commonly ingested opiate. Once broken down, the drug affects the brain's reward center, producing feelings of pleasure and well-being, among other effects. 5. Percocets. Percocet is the brand name for the combination medicine of oxycodone and acetaminophen. It is an opioid painkiller. The oxycodone part of Percocet is the opioid, the acetaminophen part of Percocet is the same ingredient as found in the over-the-counter pain medication, Tylenol. People who abuse oxycodone sometimes crush it and snort it or inject it, greatly raising the risk of an overdose. 6. Lorset. Lorset is a combination of hydrocodone and acetaminophen. Though acetaminophen withdrawal is usually extremely mild, Lorset withdrawal is best undergone with the help of a rehab or detox center. Hydrocodone is usually prescribed for severe or moderate pain. Acetaminophen is available without a prescription and has mild pain-reducing properties. However, when the two drugs are combined, the acetaminophen greatly increases the potency of the hydrocodone. Combinations of these two drugs are sold under the brand names Lorset, Vicodin, Lortab, Norco, and Zydone. Hydrocodone is frequently abused and can lead to serious long-term consequences. 7. Dextromethorphan (DXM). It's not just prescription drugs that are a problem. Dextromethorphan is a common ingredient in over-the-counter cold and cough medicines. It helps stop the cough. But large doses can get you high and cause hallucinations. It's popular among teens, since cough syrup is so easy to find in medicine cabinets. High doses also cause vomiting, rapid heart rate and rarely, brain damage. 8. Pseudoephedrine. Pseudoephedrine is a mainstream decongestant drug that is often used to self-treat allergy and cold symptoms. The sensations that are felt from a pseudoephedrine high are described as short-term and can raise energy levels, cause a ticklish feeling on the skin, and induce a sense of euphoria. Pseudoephedrine abuse, addiction, and dependence are becoming more common in teenagers and adults. This is probably due in part to the fact that it is such a widely available drug.